Hi, I'm Dr. Matthew Norton, the founder of People Plus Purpose, and this is the Truth Behind Dentistry podcast. And today, my guest is Dr. Prabh Grewal. Had to practice that. Dr. Grewal is a board certified oral and maxillofacial surgeon who, after graduation, entered active duty as a dentist in the U.S. Army, including serving as a facial trauma surgeon in Afghanistan. He later served as the chief resident at Memorial Hermann Hospital at the Texas Medical Center in Houston, known as the busiest trauma center and the largest medical campus in the US. Dr. Graywall spent the next 4 years honing his medicine, surgical, cosmetic, and anesthesia skills. Upon completing his residency, he served as the chief of oral and maxillofacial surgery at Kimbrough Army Care Center in Fort Meade, Maryland. And the highlight of his 13-year active duty career was serving as faculty and attending surgeon at the Walter Reed National Military Medical Center, better known as the President's Hospital. Dr. Graywall achieved the rank of lieutenant colonel in the U.S. Army. And congratulations and honor to you for all of that. And welcome to the podcast, Doctor.
Yeah, thank you for that. Appreciate that warm welcome and introduction. And yeah, happy to be here.
Yeah, well, you've done a lot of things. I mean, that's the abbreviated version of your introduction, and I'm always, I always want to congratulate people for all the things that they've done. Sometimes I feel like we get honored, and then sometimes people don't always maybe get honored as much as they could or even deserve for all that they've accomplished or all that they've done in serving, right? Other people or serving the country in this particular case. So I'm kind of going off of that to begin our conversation. I mean, given your vast military experience as a dentist and oral surgeon, I'm interested in kind of this is the Truth Behind Dentistry podcast, kind of
Right.
some of the distinctions in your experience of being a dentist in the military, and then how's that been different? What's been different for you as you've left that realm and are now in the private practice realm?
Yeah, that's a that's an interesting topic, and of course, there's a lot to unpack there. But yeah, it's a good point you brought up that this is the Truth Behind Dentistry podcast. So maybe we can shed a little bit of light for uh, current dentists or dental students or somebody who's looking into a career in dentistry about what it's like to kind of really behind the curtains there. So when I applied to dental school after undergrad, and just like everybody does, and you apply the same way. And the military doesn't have their own dental school. They do have their own medical school. So there is
Hmm.
one medical
Okay.
school in Bethesda, Maryland, Uniformed Services University of Health Sciences, or USUS as they call it,
Hmm.
USU. It's in Bethesda, and you can be Army, Air Force, or Navy, and they'll send kids there right after undergrad. You go to medical school there, you're active duty
Okay.
while you're there, and then you go right into the fold and start your residencies or internships right after. For dental school, since they don't have their own dental school, you apply to dental school in the civilian sector just like everybody else does. You get accepted on your own accord, on your own merit, like you normally would.
Hmm.
Once you're accepted into a dental school, you can apply for a health professional scholarship program, or HPSP. The Air Force has one, the Army has one, the Navy has one. All three branches have one. Things vary from year to year on kind of the deal that they're offering. But the gist of it is usually it's pretty much of a one-to-one. So you go to dental school for 4 years. If you get this scholarship program, they'll pay for all 4 years of of dental school. You'll get a stipend while you're in dental school, usually based on like a certain rank in that what like a sergeant maybe in that city would get based on zip code, et cetera, and cost of living allowance. You'll get sort of a stipend as well. So you can come out, for all intents and purposes, debt free. When you come out, now then you get into the military fold, and now you owe them back generally year for year. So usually you'll owe them back those 4 years, and so you start off as a captain right away with rank. You get paid your normal captain dental salary for that time, which includes some bonuses for being a dentist. And then they've already paid off all your student loans and everything, or there are no student loans. They've paid off your tuition as you went along. So it's a great experience. It's not for everybody, right? Not everybody wants to travel the world, and you don't know where you're going to get. You might not travel the world. You might end up in some places that are not as desirable, within our state, within the states, and
Right.
overseas as well. But it's a great experience for those who are looking for something a little bit different, as opposed to just getting right out of dental school and going back to their hometown or what have you, and opening up shop or joining a shop. If somebody wants a little bit of a different route, the nice thing is you don't have to commit to a full career. You can kind of take it as you go.
Right.
The vast majority of dental professionals probably do their 4 years and then exit. And then they can show you the statistics of who decides to stay in. Usually the people that stay in end up specializing. It's kind of encouraged and promoted that if you're going to make a career out of it, and when we say career, we usually mean about a full 20 years.
Right.
Usually it's encouraged that if you're going to make a full 20-year career out of it, that you'll do some sort of a specialty. It's kind of set up that way economically. The structure is that to really try to make some good bonuses and kind of, earn an earnest living that to try to keep up with maybe your civilian private practice colleagues, you need some of those bonuses, and they kind of come in the form of being a specialist. The way they've worked around that, though, so that they don't end up with just a core of senior specialists and no actual general dentists who've stuck around for longer than 4 years,
Right.
is you can become a kind of a specialty in general dentistry. They offer like a 2-year AEGD. You do that, and then now you're kind of a comprehensive dentist. So yeah, you can still kind of, you can make it work financially to stay in for a career. Then there's others like me. I ended up doing 13 years active duty, did my oral maxillofacial surgery residency training program with the Air Force and the Army in San Antonio. And so when I was at my kind of that latest contract at that 13 years, it was time for me to decide, do you stay in for 7 more, or do you get out? And so, that's just kind of a lifestyle choice for each. But it was a great career, and I endorse it. And I still encourage kids that are applying to or in dental school to look into it because it might be a good fit.
Yeah. Well, it seems like there's practical benefits, right, from that covering the tuition. Um, I don't know how many people I don't know about your situation. Maybe you can share like when you started to like where did you make the decision for dentistry as a career, and then how did that interface with the timing of a decision relative to the military? I'm imagining somebody could be inclined to be going in a military direction and then kind of clarify a professional path maybe to connect that to that is compelling, or it could go the other way to where the person would think a career in dentistry sounds great. Oh, if I was to be open to serving in the military, that could serve me in certain other ways. I mean, how does that often go, and what was your situation?
Yeah, my situation was probably like most. And so most people's situation is they choose the profession first. In this situation, if it's going to be in the health professional field, usually you've chosen to, yeah, I want to go to medical school, or I want to go to dental school, or I want to go to veterinary school, optometry. They offer scholarships for all those health professions. And so usually you've decided somewhere along high school or undergrad that that's going to be your route. You've then taken those undergraduate prerequisite classes to get you into that, and you've taken your admissions test. There's usually an MCAT or a DAT, and then you get into that, you apply and get in. So usually most people are going to actually be looking for the profession first rather than the military. And then somewhere along the way, it generally ends up being that somebody finds out about the military, that they can offer scholarships, that they can pay for it. And it usually ends up just being a really, the initial entry point for most people is a financial one. However, of course, there are a lot of people who maybe had a background with somebody in their family in the military. They've already kind of been leaning that way. But generally speaking, it's not going to be kids coming out of high school thinking, I really want to join the army. Let me do so as a dentist. It's usually going to be kids thinking, I want to be a dentist. And then eventually they find out, hey, wait a minute, this is kind of a nice way to do it. Because as the kids nowadays will know that are, listening to this podcast, that the amount of student debt that people have to take on nowadays is
Yes.
astronomical.
Yes.
My route was such that I wanted to go to dental school when I was in undergrad. I knew I wanted to do something in the sciences. Got to undergrad. My sister and some of my family members were in dental school at the University of Pacific in San Francisco. Having kind of heard from them what they were doing and they liked it, I decided to kind of keep that as my path. So I was pre-dental in undergraduate. And then when I applied to and got accepted to the University of Pacific, I remember this is now 2000. I started dental school in 2002. This is like 2000, 2001 at the time when I'm getting, got my acceptance letter. I remember talking to one of my college roommates thinking, hey, man, and in those days it was going to be, I think it was $270,000. I was going to end up being in debt after dental school.
Right.
And he told me, he said, hey, I think the military can pay for that stuff. He said, I had a brother-in-law who I think became an optometrist and the Air Force paid for it.
Ah,
So I
huh.
went home that summer and told my dad, and he quickly put me in the car and we drove to a local recruiter station. And they let us know about the health professional scholarship. To be real frank, my dad, who had a master's in economics and was a small business owner, his suggestion was, well, look, if you're going to be $250,000 in debt in California, you got to make $500,000 first, and then you're going to have $250,000, after tax dollars to pay off. If you're going to do at this time, University of Pacific is at the time, and maybe still only the only 3-year dental school. You finish it up in 36 months. You just kind of go year round.
Mhm.
At the time, the Army scholarship was 3 years for 3 years. I think they've changed that since, and you still have to pay them back 4 years of time because you're still
Okay.
paying. They're still paying the same tuition, if
Okay.
in the top five of tuitions. But at the time, my dad said, "Look, they're going to still pay you, 100 and 120K a year at the time it was as a captain salary for those 3 years. Plus, you're going to come out having basically made 500,000 on top of that they'll paid off for the debt." So he said it's a no brainer. Even if you just want to do your 3 years and get out, it makes
Right.
total sense. And
Yeah.
that's how my journey in Pat started. I thought I'll do my 3 years, I'll get out, it makes economic sense, but lo and behold, ended up specializing, doing a whole career, multiple tours, and 13 years later.
Yeah. And you stayed. So obviously it was a compelling opportunity. You kind of mentioned a little bit about why it might not be for everybody, right? In terms of what you're looking for, the travel piece, where you might end up and all that. But would you say on the other end of that, that there may have been opportunities there that you may not have been able to uh, recreate somewhere else as a result?
Absolutely. Absolutely. First of all, the ability to travel the world. My first duty station was Germany. So after graduating dental school, I went to officer basic training course in San Antonio, Texas at Fort Sam Houston, and then I was off to Germany and I got to live in Europe, and so did multitudes other of my colleagues. And you're living in Europe, it's a whole different feel. You can visit as many times as you want. There's nothing like living there, and you're not living on a base. You're living in town, in a small German town or a large German city based on where your base is. I had buddies in the Air Force and the Navy that have been stationed in England and Japan, and so you can get some wonderful experiences with their families, wives and children, and females with their husbands and children as well. And so there's experiences that you'll never be able to recreate, right? You'll never get a chance to be 24 to 27 years old and a young single captain living in Germany for 3 years serving in the military. That time can only be then. Those experiences can only be through the military. The other thing I'll say, now being back in Southern California, I grew up in Northern California. Places like Southern California, New York, certain areas like this, which have huge draws, you'll find that so many people never really leave. And it's really just because you don't have to. There's so many opportunities in the place like this. You can end up doing undergrad, grad school, everything here, and then having a great career here and finding a home base here. And so what you find is having joined the militaries, I met colleagues and people from all over the country, right? And so my friends and connections now expand so far, across the world now, honestly. And then also for me personally, to be able to have served and deployed and had that deployment to Afghanistan, during Operation Enduring Freedom, in 2011 when everything was going on.
Right.
That's a once in a lifetime experience, something I'm
Right.
proud of, something I can say I did and serve, for my country, something I can tell my three boys that I did as well. And so you're not going to get those experiences any other time, any other place. From a professional standpoint, uh, the types of surgical experiences you're going to get, obviously, in a deployment and in a war zone, places like that. That's not something you can replicate anywhere else. And just the fact that you get to you do move around for better or for worse, and that's maybe the some parts that's not for everybody, right? Is some of the maybe there's some physical training requirements, of course, to keep up with, and then moving around. That would be the one things that probably are dissuade some people from doing it. But otherwise, professionally, because you get to move around, I've worked in so many different environments and different types of clinics and hospitals, and you get to have so many different leadership opportunities and do things outside of dentistry.
Right.
You're also,
Yeah.
by definition, as an officer in the Army and in the officer in the medical corps and dental corps, you're going to have these other duty and staff positions are going to give you to do, and so you're going to learn a lot about administration and bureaucracy, and so it just helps you. When I came out and then came into private practice, I have 9 employees right off the bat. It wasn't that big of a deal for me because I'd ran large clinics and within the military, and I'd started them up and shut them down and transferred over locations. And so you get so many different experiences that otherwise you come out of dental school plus or minus residency, boom, you're into some sort of private practice, and then there you go, and you'll do that till
Right.
you retire. You
Right.
never have an opportunity to get
Yeah.
those variances of experiences besides something like the military.
Yeah, that's kind of what I was thinking as you were talking and as I was kind of preparing for our conversation. Something I hadn't really spent that much time thinking through to that point about not only the travel opportunities, but the wealth of the broad array of experiences that had to have led to growth and development and maturity for you as a man growing up into this profession. And it just seems like it would equip you for a variety of next phase kind of elements. So it seems like I'm kind of convinced it seems like an advertisement that makes sense for a lot of people to
Yeah,
consider an approach like that.
absolutely, absolutely. Yeah, I agree.
Uh, so now coming into private practice, what I want to go into what you're doing now, but before we even go more into the kind of the DSO direction, maybe you can contrast a little bit from military into private practice. I mean, you kind of mentioned a little bit of maybe what you were prepared for, a little ahead of the game because of your leadership while you were in the military. But what was different for you, or what surprised you? What was different than what you expected?
Yeah, I think a lot of people would maybe expect that, oh, running the business or running a business and payroll and HR and marketing and dealing with, business, keeping books balanced and all that stuff would be a problem. It's really not, to be honest with you. Nowadays, first of all, you can outsource all that stuff if you want, as much or as little as you want. And, I would tell most young dentists coming out that are listening to this that don't be overwhelmed by that stuff. You're smart and you have some ingenuity behind you. That's why you've been able to kind of you have figure it outness. I would say that's why you've been able to make it this far into your career,
Mm.
and so you'll figure that stuff out. Let's put it that way. As far as leading people and everything, yeah, I would say a lot of that comes from experience and a lot of that comes from innate personality as well. But you can get better at those things. And so for me, an advantage was, yeah, I'd come out from 13 years of having had experience under my belt versus coming right out of school or right out of residency. And so the ability to kind of lead, manage people, establish a culture, that part was fine. I would say the biggest surprises or the biggest hurdles were really just dealing with the difference in patient population, the difference in a patient population in a military setting or in a government setting. It's a captive audience, right? You could equate it maybe to the NHS in England or healthcare in Canada. But patients come in, you get to do idealistic treatment. There's no financial affiliation attached to it at all. And we're not just treating active duty. So to get the wealth of experience, we're treating their family members as well, right? And so you're treating spouses, children, grandchildren, parents, retirees, their family members. So otherwise we would only be treating 18 to 30-year-old healthy people. That's not beneficial. So we
Right.
treat everybody within the global kind of Department of Defense population. But they come in, you do an exam and a consultation, you give them your best opinion on a treatment plan. There's really no cost associated with it. So they're going to say, perfect, doc, sounds good to me, because you obviously have no other motivation than idealism behind your treatment plan, right? And then also for the active duty population, especially, it can take as many appointments as it needs. Their time off is kind of covered, right? They're government employees. They can be off as many times as they need for your appointments. It's at your whim. You can take, you can do as many procedures and surgeries as it takes to get the patient to the end result. They can take as much time off as needed. All that's covered. You come out to private practice, patients like, look, I got to take off time out of work. How much is this going to cost me? And you're like, well, I don't even know. Talk to Rosie,
Right.
and so there's all that you have to deal with, I think, where you're trying to just do your job as a doctor. But the patient's looking at it like it's a business, and they're looking at you almost sometimes as if like you're their mechanic, right? And you're really just trying to be their doctor.
Right.
Um, and so in the world of specialty, you add into that the layers of the referrals, right? And then there's a lot of personalities to massage. In a military setting, it's a confine. The dentist needs to refer you, they refer you, right? You have a kind of a referral system. They shift down. And for better or for worse, there's not a lot of personality involved one way or the other. And you're the oral surgeon on the base. They're going to come see you.
Right. Right.
However, in private practice, everything, they're coming to see you because they choose to see you. And so there's
Yeah.
a lot of relationships. I'd say with every tooth that I take out, there's attached, the patient, the referral, the staff in my office,
Right.
and a lot of people that flow through to get that treatment done. And so there's a lot more that goes into it than versus just showing up and treating the patient.
Yeah.
Whereas in the military setting, you get to kind of show up and do your work and kind of really just focus on being a doctor, and the rest of it kind of takes care of itself or is taken
Yeah.
care of for you.
Yeah. No, that was good. Very, very well said. And so I think the case acceptance piece um, is different for those reasons that you mentioned. And um, yeah, and just um, the need to be able to communicate and like how does the practice grow, whereas that's not really a concern for you when you're in the military. So in the
Correct.
those
Exactly.
those
Exactly. You're
five,
always busy. Yep. You have a beholden captive audience.
yeah,
There's enough work to do and you stay busy in the military and you get
yeah,
to focus on that. And on the outside, yep, you have to continue to try to find ways to grow, to improve, and to keep the practice kind of, moving forward for
yeah,
yourself and for your staff, right? You owe it
yeah,
to your staff, you owe it to your
yeah,
patients in the community, and you owe it to your
right,
referrals as well. If
right,
you're not growing, then you're shrinking and that's not
yeah,
helping anybody.
yeah. Yeah, there's a patient experience component that's important, but then there's
Correct.
also a team member experience that's important. And
exactly.
those are things that you're not thinking of as much when you're in the military, in that environment, I'm sure. So,
Exactly, exactly. So that's been the biggest transition, I would say, is just remembering that there's a, in private practice, the truth behind dentistry. When you're a private practice dentist of any kind, there's a lot of people you're responsible for keeping happy on a daily basis, and it's not just the patient.
right.
And along with every person you have to try to keep happy, there's, responsibilities and headaches and things that go along the way. And so that's what I'd say is the biggest truths that come out, coming out of dental school or residency and coming out of a military setting or anything like that. Once you're out on your own private practice, it's just the amount of people that are all kind of looking to you to make sure that everything's always going and humming along nicely.
Yeah. Yeah. I was in a
Yeah.
conversation earlier today with a doctor who we were talking about some of these things because we were distinguishing those people who really have people skills that have been developed or they're working on refining more versus the science, the drive into dentistry based upon science and, the love for biology, for anatomy, physiology, all these things. And the technical skill sets that are involved, but the people part is a stretch. The people part is almost an unwanted
Right.
addition, even though it's the essence on the foundational level, it's the essence of the whole thing.
Right. Exactly.
You happen
Exactly
to be
right.
a lot of things to a lot of people, right? And that's
Correct.
not an
That's yeah,
easy
that's
thing.
no, that's a good way to say it. You're a lot of things to a lot of people. Yeah, that's exactly right.
So you
Yeah.
ended up then making a decision to get involved in a DSO. I would love to hear a little bit about what that experience is like for you. Uh, I don't know, any pros, cons that you might want to share with our viewers, but then also what led you into making a decision like that?
Yeah, yeah, and that's a good good question. We can touch on that as well. Most people are familiar with these, obviously everyone's familiar with the DSO model and what's going on. And in the specialty platform for oral surgery, it's been around for a while. And so most of us coming out of residency have been hearing about this already. I wasn't looking for that right away, right? And so thus after getting out of the military, I bought my own solo practice from a successful solo practitioner who's been doing it for 34 years, and I, took over and transitioned from him. However, after joining the or after purchasing the practice and being a solo practitioner for we were together for about a year, then he retired, and then I was solo after that. And knock on wood, we've been successful and we're growing every year over year since, and going into year 5 now. However, as we talked about, there's a lot that goes into that. And so as I started looking around and saying, okay, do I want to do it exactly like this, 5 days a week, full time by myself for the next 20, 30, what have you,
Right,
years?
right,
If the answer is yes, then perfect, you keep on going. For me, the answer was no. I wanted a little bit more freedom of time. I had left the biggest group practice in the world, right? The United States Army, right? That's
right,
about as big as a group practice as there is.
right,
To be real frank about everything, the truth behind dentistry is, to follow the theme of it. I got 30 days paid leave when I was in the military. I got to take some time off. And when I took time off, I was truly off. Somebody was taking care of my patients. I wasn't worried about some overhead or my staff or whether they were on or off. However, when you're a solo practitioner, all that matters. Taking time off is not that simple. A lot of things to take into account. The patients need you, the referrals need you, your staff needs you to be there. So a lot of people are waiting for you to come back. There's a financial cost to taking time off. That's kind of a double whammy when you're a solo business owner, small business owner. So for all those reasons, I said, you know what, let me look into this. Just like everything else in life, it comes down to relationships. The group I decided to join with was Allied OMS, just because I knew these guys. I trained with them. You're kind of in the trenches, working in the OR and the ER, 100 hours a week, late at night with some people. And so I kind of knew these guys and I joined up for that reason. Overall, the theme of it, though, for joining up with a platform for most specialists, I would say, is if it allows for a plan, for a strategy of, okay, what's going to happen over the next 20 years of your career. We're going to practice. We're going to come in every day to work, and we're going to see our patients and our procedures and all that. And not a lot's going to change there. But with this model now, eventually, it's easier to bring on associates, right? They can help bring on associates. The associates can get a guaranteed salary right off the bat. Whereas for me as a small business owner, that's a big burden. You bring on an associate. How do you, right? How do you pay them?
right,
These associates coming out nowadays are also already used to this model. They're also going to say, "Hey, where's my paid 2.5 days of paid vacation, and where's my guaranteed salary?" And they say, as a
right.
small business owner, I don't get 2.5
Yeah,
weeks of
right.
vacation. So this model allows for a transition into something that we're all a little more used to, I think, especially nowadays, this generation coming out. And so it allows for an easier kind of life balance. I think work-life balance, which is what more people are looking for. I think more so than we were maybe in my father's generation before me. And so I think with that being important, that was the main reason to switch over to kind of the DSO model. I'm able to be part of a larger group. I'm part of another big now again part of a group practice. Taking time off is not as burdensome to the patients, the practice, my staff, or myself financially. It also allows you some security. To be real honest, I lost my father when he was about 58 years old from cancer. And so I've always known that, hey, anything can happen at any time. And I guess we all know that, of course, but not everyone maybe lives with that so much on their forefront. I kind of do. From a standpoint of having a family, spouse, and young children, having just come out of the military, bought the practice, bought the house, and then you're sitting there thinking, wow, it's going to take a minute to climb out of this.
Right.
This model also allows you to kind of take some chips off the table and de-stress a little bit and kind of divest yourself a little bit from that aspect. There can be some real benefits as well. But just like the military, it goes back to it's not for everybody. But I would say, from what I can say, is if you're a solo private practice oral surgeon, that's what I can speak for. Is I would say if you're looking into the future, the days of, hey, I'll bring on an associate, he or she will associate for 3 4 years, then maybe they'll partner on, depending on the market and geography you're in, those days might be going or already gone. So that'd be kind of my 2 cents on that.
Yeah, yeah, that was a good 2 cents. You're a
Maybe
good
5 cents, yeah.
well. That was a good 5 cents, because I think you explain things well, so I appreciate that about you. I'm sorry for your loss, by the way, with your
I
dad.
appreciate it.
I'm not sure how long ago that was now, but that's
Yeah, it's been about 15 years now, or no, 17 years, 18 years now. Yeah.
yeah. And I think that's those kinds of things. Like I lost my first wife, I was only 30 years old. And so it's like those kinds of experiences are ones that if there's an upside blessing at some point in there, I think is that it can challenge us to consider our values, rethink certain things, priorities. What do I want to do? What do I not want to do?
Right.
So that when I get to the end, I could feel like, I mean, well, the journey all the way through, but also when I get to that, I feel like I lived a life like I wanted to live, whatever that means. I'm
Right.
hoping that
Yeah.
some people stayed on to hear this last little part, that
Yeah.
they didn't jump off when you mentioned about 30 days off in the military.
Oh, yeah, I know.
There might I thought I had like a few people hit the off button right there, thinking I'm joining up right now. They got in their car and started to head down. So so
I know that sounds pretty nice to me now, actually, too. But yeah,
yeah, yeah,
time and place for everything.
yeah. So anything that you would want to share, anything further about, kind of the experience so far and what that's meaning for you with respect to the DSO involvement, and or tell me what you're seeing out ahead. I mean, you've gone through these various things. This is that you kind of created a new path and then kind of on another newly created path, so to speak.
Hmm.
When you look out ahead for the rest of your career, I mean, what are you seeing out ahead?
Yeah, it's a good question. I don't know. For my own career, I'd love to be able to get back into doing some more hospital-based oral maxillofacial surgery, whether that be trauma, orthodontics, things of that nature. The irony of it is, I can't. Luckily, I can't afford to do that right now. When you're busy in a private practice as an oral surgeon, you're usually busy with dental alveolar. When you're solo, it's tough to get into the OR because again, something's got to give. Who's at the office if I'm in the operating room?
Right.
And generally, the sad truth behind, again, sticking with the theme of the podcast is the sad truth is orthodontic surgeries and trauma and stuff like that, unless you have a really good setup, depending on where you're at, it's not going to really pay as well nearly as dental alveolar. So we end up doing all this training and then we end up taking out teeth and placing implants all day. So I'd like to be able to get back into the OR. And so hopefully, we'll get some associates on board here coming up soon. That's the plan. Once that happens, then I'll be able to work with them and we'll have a tag team where someone can be in the OR, someone can be there. So I'd like to do that. I'd get back into teaching if I could, and or I'd go back to the VA at some point in the future if I really could as well, and do some work back there.
That's great. That's great.
Yeah.
Should we change the name of the podcast to the Sad Truth? No, I
I
don't
don't
think
think we want to.
I
Yeah.
don't think we should. I think
No.
there might be less viewers if it's always going to be sad. But
Yeah. Very true.
so to kind of wrap up, then when you look out ahead, so that was kind of looking out ahead a little bit of what might be next for you or eventual for you. Any other thoughts as far as future into dentistry in terms
Mm.
of trends you see that could be relative to your own specialty realm, or specialization in general. But what do you see as you look out ahead?
Yeah, I think, AI is going to be the thing that's already here, not coming, but we're already seeing artificial intelligence read and screen, panos and spit back out a report. Surgeon colleagues of mine are already using that technology. You'll take the panoramic X-ray of the patient, the AI reads it, and it'll chart out other things that maybe that it finds caries and things like that. You can send a report right back to the general dentist. It's already tracing out the nerve canals on our cone beam CTs. The AI is. I would imagine that there's going to be more and more of a push to replace the human element in the offices, and that's what's going to end up happening. I wouldn't be surprised if we're at a time when we walk in and there's just going to be the provider and their necessary clinical assistant team that's there. The patient might walk in the office, insurance verification, all that stuff's already been done. There might be robots or computers on wheels, right, with AI that they're signing in through kiosks for, and somebody else can wheel them back, or you can help walk them back the hallway down the hallway to the operatory. So I would imagine that's where things are going to be headed. It's going to be a different model of the way the offices look and the practices look, where there might be a lot of AI replacing a lot of the human element, for better or worse. We'll see.
Yeah, yeah, maybe for better and some for worse. Yeah,
Depends on who you are, I guess.
it just makes me think about conversations I have periodically with people about AI, and they're saying, "What do you think AI won't replace?" And then I think, well, what are the most what are those elements that are most human that we bring to any interaction that we bring to life? But I think even as you're saying there, will AI replace, what will that mean for patient experience, or, not duplicated by the humans that are adding such
Mhm.
value right now? Or do we just for cost effectiveness or, technical accuracy with AI that we're just weeding out the more of the human beings? I don't know. It seems like a slippery slope in some ways that, I don't
Yeah,
know.
yeah,
Yeah.
yeah. I agree with you, but maybe above my pay grade. We'll see what
Yeah,
happens.
well, yeah, it's above mine, I think, as well, but interesting
Uh,
to speculate a little bit as to what it might be. Well, I really appreciate the time with you.
yeah,
I find people's journeys fascinating, and I think you've had a fascinating journey to this point, and you're not done. So, look forward to staying in touch and seeing where things lead you in the years ahead. If somebody wants to reach out to you to connect, for whatever reason, because they've been inspired by this, they'd love to, have a conversation with you. What's the best way to reach you?
yeah. They can email me. It's my last name Grewal and then OMFS. So Greywall OMFS at gmail.com.
Okay, awesome. Well, thank you for your
Yeah.
time. I appreciate you.
Thank you. I appreciate it.
Yeah, absolutely. So thanks for watching. This is the Truth Behind Dentistry podcast, as Dr. Graywall fondly referred to it many times in our conversation. That was very good, by the way. And appreciate you watching, and look forward to the next time. Please tell your friends about us and subscribe, and we look forward to seeing you soon. Thank you.